Good morning, everyone. Welcome back into North Dakota today. Lung cancer is the leading cause of cancer-related deaths of men and women in the United States. Kayla Clausen, nurse practitioner, and Heidi Panos, director of cancer services with Altru Cancer Center in Grand Forks, join us to discuss more. Welcome, ladies.
Thank you.
Thank you.
Yes, well, I'm glad you made it on the slick roads.
Yes.
Yes, so let's get into it. Can you tell us what is lung cancer and what are the main types of lung cancer to be aware of?
Yes, so thank you for having us today. Lung cancer is when cancerous cells grow in the lining of the lung, most commonly along the airways. And like you said, it's one of the most common cancers we see at the cancer center, apart from skin cancers, of course. So really important cancer for individuals to be aware of.
Yeah, absolutely. Can you tell us about some of the lung cancer risk factors?
So the primary risk factor is, of course, tobacco smoking, and that's kind of what we're focusing in on our screening program for patients, and that's how we make our screening criteria for patients. But there's also other risk factors to be aware of, such as genetic predisposition, could be other environmental exposures, such as radon or asbestos.
So I've heard that, obviously smoking tobacco is very detrimental to your lungs, but I've heard that secondhand smoke can be very detrimental as well. Do you want to talk more about that?
Yes, so that's definitely another one of the risk factors. Not something that we have a screening recommendation for currently, but it is something for people to be aware of, and trying to reduce their exposure to secondhand smoke is really important because it's something that we have control over, right? We don't have control over our genetic predispositions or our family history, but we can control our environment.
Yes. So what are some symptoms of lung cancer?
So common things that you can see with lung cancer would be something like cough. Sometimes coughing up blood can happen. Recurrent lung infections, shortness of breath. Those would be things that would be concerning for lung cancer. Sometimes loss of voice or hoarseness. That's kind of chronic, ongoing. Other things could be kind of more vague, such as ongoing weight loss, fatigue, generalized weakness, things like that. But we do, as we're talking to patients and kind of trying to promote health for patients, we like patients to keep in mind that when you're starting to develop those symptoms, it's when your cancer is in a later stage. So our screening is really trying to prevent and catch the cancers earlier before you're having any of those symptoms at all.
Yeah. So how would you say that lung cancer is diagnosed?
So sometimes lung cancer is diagnosed incidentally when you have a chest x-ray for other reasons. But if you're having some of those symptoms we talked about, you may have further investigation of those with things such as a CT or a PET scan. That's commonly what we use kind of when we're first investigating possibility of lung cancer. But then subsequently we would look at, getting a needle biopsy using some tissue to make that final diagnosis with a pathologist.
So you guys are having these free screenings at Altru. Who is really eligible for this?
Yep. So we're really excited to be offering free lung cancer screenings during January. And eligibility for our free CT scans are for people who are over 50 years old, and also a smoking history of either 1 pack of cigarettes a day for 20 years or more, or 2 packs of cigarettes per day for 10 years or more.
Wow. How important is that then, if this sounds like you at home, to really get out and get those screenings?
So I really encourage patients to be informed, right? The more information we have, then we are able to make better decisions. So as a part of, the lung cancer screening is just making sure that you have all the information possible to make the right decisions. And like I said, trying to catch cancer earlier, where this is not something where you'll need adjuvant chemotherapy or a longer treatment plan, that this can be more of a curative intent treatment for cancer.
And how does this feel for both of you to be, medical providers and to provide this for the community?
So it's really rewarding. We've been really successful so far in the month of January with our CT scanning. So I've been really happy that patients are taking advantage of this and the service that we're offering to patients. So it's in one part reassuring for patients that we're really empowering them to take charge of their health in the month of January, when we're all focusing on how we can maintain or improve our health, but also empowering them just to be educated, and then hopefully encouraging them along the tobacco cessation route to prevent cancer in the future.
Yes, absolutely. Well, thank you ladies both so much for coming on and also for providing this great resource. It's really excellent.
Yes, thanks for
you.
having us, and
Yes, of
Happy New
course.
Year.
Yes, Happy New Year to you too. All right, everyone stick around. We have much more yet to come right here on North Dakota Today.